Thank you again for our coronavirus for joining us during our coronavirus updates. Just a few days ago, we were able to be joined by Rich Giebert, the president of the Illinois Farm Bureau, to talk about how coronavirus and our fight against this deadly disease was impacting our agricultural community. And today, we want to talk healthcare. And I can't think of a better person in a system like OSF to talk about what they're doing to fight COVID-19. And we're here with Dr. John Vozenilek, who is with OSF. OSF runs facilities in my district, the 13th district in Champaign and also in Bloomington. And Dr. Vozenilek, thank you very much for being a part of this.
It's a pleasure to be a part of it and to serve. Thank you.
Well, thank you. You know, we had a good conversation a few weeks ago about your pandemic response program. And you guys call it the Pandemic Health Worker Program, right?
That's
can
correct.
you tell us a little bit about that program, what OSF's been able to do and what you've been running and how successful it's been?
Very, very early on in our appreciation of the crisis, we began to mount a response, starting with our call center, and then created layers of, apart from nursing triage, we actually added physicians and others. But the Pandemic Health Worker Program is one that allows lay people, trained folks that we bring into our program to participate by connecting with patients and then escalating care as needed if there's a need. So we have two types of pandemic health workers. One is a fielder. That's a person who comes to the client's house. They ring the doorbell and they leave them a care package with a variety of material and ways to connect digitally. And then they guide the person through the onboarding process and connect them with our digital response, which includes, again, physicians and nurses to back up any of the symptoms that the client may have.
Great, great. What counties are you serving within the 13th Congressional District? You got McLean, Champaign, anywhere else?
In fact, when I took a look at our detailed map, I found clients from our program in every county in your district. Yep. So we're here, there, and everywhere, and we're ready to serve. The governor had announced this program on April 11th, and then once again on the 18th. And when he did so, he described a layered approach where OSF Health Care would serve the folks of Central Illinois.
Great, great. We appreciate what you're doing. And also for those who are viewing this, if you have a question, go ahead and type it in. We'll make sure that we get a chance to see your question. And if we can, we'll make sure that we ask it. Dr. Vozenilek, if somebody believes they're eligible for your program, what should they do? Who should they contact?
Well, our program is offered free of charge by the state in partnership with the Department of Healthcare and Family Services. This program is offered through OSF at the following phone number, 833-OSF-KNOW. After that phone call, there's a brief enrollment conversation and materials are offered to the client of this program. But again, this program is offered free of charge for the symptomatic folks of our communities to really guide them through a period of time where they're going to need a little bit of medical advice, a little bit of clinical help along the way. And
if somebody's not part of those counties, you can have them call the same number. You guys are even out. You guys are statewide?
Yes. Our range, it goes from about Alton all the way north through Rockford to the border, and then across all the way across to Evergreen Park, southern suburb of Cook County. So it's a broad geographic distribution, and we aim to serve.
Well, thank you for that. And you guys are leading the fight in beating this deadly disease. I mean, we're all in the same team here. We all want to make sure that our medical professionals are the ones leading the charge. What are some of the challenges that OSF is facing right now in this COVID fight? I know the early challenges are PPE and also access to testing. How has that improved, or has it? And what are your challenges now?
Right. So I would describe the pandemic experience thus far to have been slowed into a smolder. Originally, our thought was that this could be a very explosive burn where many patients were going to arrive to our hospitals, and we were going to have a problem where our hospitals and clinics were massively overwhelmed. Because of all the effort that went in to flatten the curve and to mitigate or slow down some of that response, we've had time to collect ourselves. We feel like we have appropriate preparation. And with programs like ours, which connect patients and allow them to um, get advice before seeking help at the emergency department, we've seen a reduction in some of the risk for contagion for sure, but also some of the reduction of the burden on the traditional bricks and mortar facilities. So for us, this has been a very effective measure, and we see it now as a particular advantage to the state. Testing is a major component. You mentioned testing. Testing is a major component of the statewide response. Now, this program relies on agencies in partnership with Illinois Department of Public Health and other clinical resources to do testing. This program is about what happens after you get a test or what happens when you're symptomatic. And it's a key distinction. I'm very pleased that overall we're seeing the increased availability of tests so we can really get our hands on exactly how many folks have been exposed to COVID.
So with the testing, you've seen an increased availability of tests, as have we. The Department of Health and Human Services has stood up a testing facility in McLean County. Darren LaHood, Congressman LaHood, and I visited there about a week and a half ago. Walgreens has put a facility in my district in Springfield, where Darren LaHood and I got a chance to tour that just last week. We're seeing the availability of testing, the machines that can give a quick response are in our district and in Illinois. But what's next? What do we need to do to make sure that we continue to flatten the curve and take this smolder, as you put it, and put it out, put this fire out for sure?
Right. This is a broad challenge that has been described frequently in the media. The so what component of this is truly so important. So you get a test, and then what? What happens next? Well, adherence to those key behaviors that keep contagion down, social isolation if necessary, quarantine, keeping one's contacts close, reducing the need for additional tracer mechanisms. That's where you're looking for exposure. Perhaps somebody had been at the store and they come up COVID positive. Well, 3 other people may come up positive. So what we're seeing next is a challenge to, after the test is more ubiquitous or commonly available, to then take the next steps to guide behavior and to provide tracer so that we can reduce the spread of the infection. That's how we're going to shorten the curve. We've done quite a bit to flatten it. Now we need to start shortening it up.
That's a good reminder for everybody watching right now. That new terminology. If we want to get back to some sense of normalcy, let's stop flattening the curve and let's start talking about shortening the curve. I agree wholeheartedly. Doc, just so you know, I want to make sure that the folks have the number that you've put forth earlier in the show. And I want to make sure that they also know where to go online so that they can get access to information that OSF and your team has been putting out. Give us that number again, and give us that website.
833 OSF, no, KNOW. And then if you go to osfhealthcare.org and then you do the /PHW, you will find our program. Of course, at that phone number, you'll find friendly people. These are people serving people. That's key. These aren't robots. These aren't folks that, are in a call center somewhere trying to sell you anything. These are servants who are trying to help our population get better, to serve them well, and to provide them resources that are much needed. So it is 833 OSF KNOW.
Well, this is great news, great information. I appreciate you taking the time today. Please do us a favor and thank everyone at OSF and all of your healthcare heroes who are fighting this deadly disease every day. Thank you for your leadership in making this pandemic health worker program available. I really appreciate you taking the time today. And before we leave, I want to remind our viewers that we're going to have another episode of Live with Rodney during the COVID-19 fight. Come Wednesday, on this Wednesday, April 29th, 4 p.m., I'm going to have another guest. It's going to be our minority whip, my good friend, Steve Scalise. We're going to talk about unemployment insurance issues in his state of Louisiana and also unemployment issues in our home state of Illinois. And then also just talk a little bit with Steve and get to know him a little bit better. But Dr. Vozenilek, I really appreciate you taking the time. I know you're very busy. Thank you for your leadership. And we will sign off right now on Live with Rodney. Thank you, and thanks to OSF.
Thank you.